Hello again, everybody. My name is Marty Guthmiller. I am CEO of Orange City Area Health System, bringing you today a special edition of our COVID-19 community briefings. And the special edition, as our 78th, will be solely on our current understanding of the vaccine and more importantly, its distribution plans. This is still a very fluid situation and is subject to change. But again, in an attempt to be as transparent as possible, I wanted to give you this information as soon as we have it, this was as of this morning. First of all, there are two key elements that we need to understand in this vaccination process. The first regards nursing home residents and staff, and that also includes assisted living. This vaccination strategy, as mandated by the state and the country, is coordinated through Walgreens and CVS. And so in our location, Walgreens will be administering and controlling the whole senior care population vaccination program. Those are not doses that will be available to us. These will be doses that are actually given by Walgreens staff in our case. Our current understanding is that a vaccine will be from Pfizer, and that is expected to begin on December 27. And so the process for beginning our seniors will be on currently anticipated December 27. So while we have that first component of our population group, the second component is the general population. That's a little more complicated. We are currently of the understanding that we will be receiving our dosage from Moderna. It'll be the Moderna vaccine. We are expecting 320 doses on December 21. We will begin administering those vaccinations on December 21. If we get that in the way we're supposed to, we will begin that administration immediately. It's important to understand the prioritization of these 320 doses. As we've talked about before, our most vulnerable population is our senior group. But again, now they're going to be taken care of through the Walgreens process with the Pfizer vaccine. The other vulnerable group is our frontline healthcare workers. And as just mentioned, we'll be dealing with those beginning on December 21 with the Moderna vaccine. It would really be irresponsible of us to take the 320 doses and apply it in our senior community, because we would be forfeiting those number of doses then from Walgreens. This is not something where we could swap dosage. We will be foregoing that, and so we will not be doing that. The prioritization will include frontline workers, and there's a whole series of things that we're going through internally, but certainly we start with all of our caregivers, the physicians, the nurse practitioners, the physician assistants, the CRNAs. We move to also ER workers, the staff in the ER, the ambulance teams. We move quickly to the floor and the nurses on the floor, the housekeepers who are cleaning the rooms on the floor, dietary people who interact with people on the floor. So you get the idea. We have a hierarchy internally of those folks who are most vulnerable to the virus, and we'll be prioritizing our internal staff that way. There's also if you've had the COVID virus within the last 3 months and have antibodies, obviously from that, within the last 3 months, you will not be in the first tier. We will move that person to a second tier, to the second administration, because they're already protected. And even though we're anticipating the immunity to be 6 months at this time. We're allowing anybody that's had more than 3 months to be considered in that first tier. So there will be some prioritization based on that. We're still expecting some doses to be available after this process, probably quite a few. And so one of the things that we're doing, since Landsmere Ridge is not included, the independent living in Landsmere Ridge is not included in the Walgreens senior care proposal, we will be including them as a high priority item, high priority tier within the dosages available to the general population. And so we're in the process of determining right now which Landsmere Ridge independent living residents actually want the vaccine. Those that want it will likely be considered in our hierarchy of vaccinations occurring beginning on the 21st. We're also going to be visiting with a Pioneer Home in terms of another group of vulnerable folks, and we'll be working with a Pioneer Home in terms of which residents of the Pioneer Home would want the vaccine or not, and working through those. We'll continue to work through that list. Maybe at some point we get to the thing of, if you're 70 and over, give us a call, but we're not there yet. We are going to prioritize in accordance with what I just described. So again, if you've had the COVID virus, you're not really eligible to be in the first tier for at least 3 months. Just some things a little bit more about that, and about the Moderna one particularly. Our understanding is they're going to come in 10-dose vials. So once we open a vial, we'll have up to 30 days to use that vial. We'll be doing our vaccinations at least in groups of 10 to make sure that we're fully utilizing each vial as we go along. So the 10 doses per vial is that's not insurmountable at all, and it's not too many folks to have lined up. And again, it's 30 days of viability once it's unfrozen. Again, if we keep the dosages in the freezer, we can keep them for a period of time. But once we unfreeze them, we have 30 days. It's also important that both Pfizer and Moderna are 2-dose vaccines. They're in the series. You need to have both to reach full efficacy. And you don't reach full efficacy until a period of time after the second dose. We're not sure exactly what period of time. A couple weeks might seem reasonable. But with the Moderna, you cannot receive the second dose earlier than 28 days from the first dose. So if you figure roughly 1 month, and you figure at least a couple weeks after the second dose, you should be thinking about at least 6 weeks post initial vaccination before you've reached full efficacy. Now, the 6 weeks is just kind of our estimate at this point, but we'll get more clear guidance on that. But it'll be sometime after the second dose that you'll receive full efficacy. Again, with Pfizer, that 28-day period is 21 days. So our nursing home residents will be able to receive the second dose anytime after 21 days. And again, then we'll learn in the guidance when they reach full efficacy of the vaccine and when it's safe again for them to interact with folks the way that we've historically done. That is a priority to us. We want that to happen as soon as possible. But when you think about the nursing home getting back to normal, it'll be sometime after, sometime in February at the earliest, maybe March, if things go according to plan at this point. Another question that we're anticipating is, are you going to require your staff to have the vaccine? Another question might be, are you going to require your nursing home residents to have the vaccine? And the answer to both of those is no. We will not be mandating the receiving of that vaccination. In a similar way to the flu shot, will not be mandating that. And so that's the way it is. We'll not be doing that. There'll be some consequences to people that don't wear it don't take the vaccine in terms of PPE and wearing masks and things like that. But that is their choice, and that is consistent with how we've administered these kinds of things in the past in terms of mandating vaccines. There will another question that you may have is, what's the cost of the vaccine? The cost of the vaccine is $0. There will be no charge for the vaccine itself. It is likely that we will have an administration fee that will be fully covered by your insurance plan. So that's a little bit on that front. Again, these plans are subject to change. You know, we all know in 2020 things can change in a few minutes. But I wanted to get you this information, primarily the 320 doses expected here on December 21, and stay tuned for more specific instructions as to when that vaccine might be available. Probably most importantly to those of you who are in the general population, and how you can access this. So anyway, I wanted to get that to you. I still anticipate doing a briefing either tomorrow or Friday to get back to some of this statistical information. And if there are any changes in what I've just told you, I will certainly relay them as I can. So thank you. In the meantime, stay vigilant, stay strong, and stay healthy. Thank you.